Good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Welcome back to Open Mics with Dr. Stites. Healthcare is based on science, and that science depends on research that ideally accounts for each person's differences in biology, behavior, and their environment. You may have seen signs like this throughout the health system and the University of Kansas Medical Center. Together, we're working to help make sure folks here in the Midwest are represented in the All of Us research program, a large research program for the National Institute of Health. Tonight is a ceremony to officially launch All of Us here in the Midwest. A research endeavor so large, everyone, including you, has the chance to participate. Helping us learn more is Dr. Akenelolu Ojo, Executive Dean at the School of Medicine here at the University of Kansas Medical Center, and a really good friend of mine. Also, good morning.
Good morning.
Also, Dr. Matthias Salate, another really good friend of mine, KU Med's Vice Chancellor of Research and Interim Executive Vice Chancellor for now. Plus, our special guest from the National Institute of Health, Dr. Josh Denny, the CEO of the All of Us research program. Welcome aboard, sir.
Thank you. I am very pleased to be here and celebrating the kickoff of the Kansas program.
We are delighted to have you here. And we will also talk with someone who signed up early for the All of Us research program, our very own producer, Stuart Downing-Vest, who is in the control room. Stuart, live long and prosper. You're on the bridge of the Starship there. All right, too often healthcare is one size fits all. Treatment meant for the average patient may not work well for each individual. I've grown up in medicine since 1986, 1982 in medical school, whatever, a very long time ago. And we've had all these research trials which put thousands and thousands of people in it. We took the overall result and applied it to everyone, which is exactly why we want to include as many different people as possible in medical research. That's why the All of Us research program is working to enroll 1 million or more people with a goal of 3,200 participants from the Midwest over the next year. It is important that folks here in the Midwest are represented in this program, which could greatly help in the development of precision medicine, treatments tailored for an individual patient. Dr. Ojo, tell us more about the All of Us research program and why we're participating in it.
Thank you. The All of Us research program is a precision medicine initiative in which everyone in the United States and its territory can participate in. Participation in the All of Us research program includes 3 initial steps. 1, you have to donate blood and urine specimen. 2, you have to fill out survey questions. And 3, one has to donate electronic medical records on an ongoing basis. In turn, participants will get back the results of their test, including clinical genetic results and other information that they have contributed into the All of Us research program.
It's a big darn deal. Now, Dr. Denny, this is an NIH-funded program giving the medical center and its partners nearly $3 million in fiscal year 25 to help collect the data. What's the purpose of collecting all this information?
Well, it's so critical that we have representation across the country. We are seeking to create one of the world's largest biomedical research programs to tackle all sorts of kinds of diseases and drug responses to really make health better for everyone. And it's critical that we have huge numbers of populations and lots of geographies. I like saying I grew up in Kentucky and then Tennessee. I have a farmer who's a brother in my, I have a brother who's a farmer, and my
that does sound better.
It does, I guess, right? And then my grandparents lived on a farm as well. And I know that Kentucky is different than Kansas, and the exposures and the environments are different, and we have to capture all this. There's so many measures of diversity and the individual response. You know, the same medicine that I may take may respond differently than you or you, and we can figure that out with large-scale studies like All of Us. And really, All of Us is unique in this country. This is our national cohort program. Cohort's a funny word and may not mean a lot to a lot of people, but this is the way that we can capture together, make healthcare better for everyone over time.
Yeah, I'm a fan. Now, Dr. Denny, why might patients want to participate? What's in it for them?
Yeah. So Dr. Ojo mentioned the idea of return of results. When we started this program, we went to 17 cities across the country and asked them questions. Why would you participate? What's valuable to you? And the number one thing we heard is, we want to make the future better for populations like us, and especially those populations that haven't been typically included. But in addition, we also heard that people wanted information back. So we try to give value back to participants. One of the best ways we do that now is by returning genetic results. We let you learn about things like your genetic ancestry or some non-health related traits like, can you taste cilantro, or things like that. But more importantly, we do health related results too. We allow an individual to find out some information about what kinds of medicine would work best for them. If they carry risk of a hereditary disease, we can do something about hereditary cancers like breast and ovarian cancer, or heart conditions like arrhythmias that could potentially be fatal, but if we find it early because of genetics, there's something you can do to prevent that risk.
That sounds incredibly important. And Dr. Salate, historically speaking, medical research has not been very diverse. Talk to us a little bit. Why is it so important to change that?
So I think a lot of people already said something about that, but we are all different. We think we're similar, but we're not. And a lot of research has really been done in patient populations that are similar, large VA cohorts, large other studies that have mainly enrolled white people. Now, that doesn't really then apply to everyone. I mean, we thought it's applied to everyone, and we gave the same treatments to everyone, and we know this is not true. So enrolling a wide variety of different people across the country is so important. And in the Midwest, many times this was sort of a Star Trek analogy, like a black hole, right? There was not that much in this area where people participated. Rural populations, they have a hard time to access, and it is extremely important to include those people, because we need to learn about what kind of responses to therapies and prevention that was mentioned is relevant for them, and we really don't know that. So it is going to be very critical to enroll all of these people. All of us.
Well, and not to say, but Wyandotte County tends to be an incredibly diverse place. Yeah. Over 60 or 120 languages are spoken within this county. I know we have more different kinds of interpreters online than you can shake a stick at, because we have to be able to communicate with our patients. So I'm going to take this both to Dr. Salate and Ojo. KU Medical Center is leading a consortium in the Midwest that is participating in all of this. Tell us what institutions make up that consortium.
In addition to the University of Kansas Medical Center and the University of Kansas Health System, we have the University of Iowa Hospitals and Clinic. We have the University of Missouri in Columbia Medical Center, and we also have the University of Nebraska Medical Center.
If you go back to the old Big 12 days, it may have been a while since KU and MU did something together like that. That's a kind of fun deal, or even really KU Nebraska, KU Iowa. So that's a darn big deal. Now, Dr. Denny, 1 million people is a lot, and 3,200 from here alone is a big goal. Tell us why so many folks are needed.
Well, it goes really back to some of the comments we made. There's a paradox with individualizing medicine to one's given makeup, is you need huge populations to understand medicine well on an individual level. And maybe I can just give a brief analogy of the genetics that we've already looked at. So we have a lot of genes. We have a lot of individual nucleotides that make up 3 billion base pairs in our genetic code. And in our program, we've already sequenced 250,000 people, and we have discovered over 1 billion genetic variants.
Wow.
And
okay, so that's a lot. In 250,000, you got over 1 billion. That's a lot of variants, right?
And most of those occur in one person. So those, as we think about what those mean potentially for health, and most of them probably don't impact health. They may have a mild change in eye color or skin color or something like that, or they may not really affect anything, but some of them are going to affect health, and some of them are going to affect whether someone's at risk for cancer or whether they respond to a medication. And the only way we're going to do that is by having electronic health records, by having lots of people to figure this out. And most of these, by the way, have never been seen before. we are seeing for the first time the genetic variation in our program that has never been reported in the rest of the world. So it's great for world leadership in science and advancing science. And it's so important, as we've said before, having everyone represented, everyone at the table, so we can understand the basis of how we can make health better, discover those new therapies across all sorts of conditions, and understand the risk.
That's you just think about the immensity of that and the immensity of the amount of information and how impactful this will be. And I'm going to look at you, Dr. Stites. You and I both practice the area of cystic fibrosis. Talk about the meaning of precision therapy in the lives of CF.
Well, when you think about cystic fibrosis, you think about a disease that was devastating probably about 30 years ago. Nobody really believed that you need an adult physician to see any of these patients because they unfortunately all passed away way before their teenage years. The next step in therapy was really to treating the chronic infections and the malnutrition, and that made a difference. But what really made the difference is understanding the genetic diversity even in the cystic fibrosis gene and how it causes disease, and then develop these new therapies that we have now available that address the specific genes that we know about. So right there, precision medicine, because not everybody will respond to the same therapy. But if you're born today with the most common mutation, which is called F508 del, it's always tricky how it's changing every few years. But if you're born today with that mutation or that genetic variable, you have a normal lifespan given the new therapies. And that's a huge difference compared to 30 years ago.
Yeah, that is such a dramatic deal, and that is true precision medicine. Now, Dr. Ojo, I know our website is up, and at joinallofus.org/Heartland, just to say that out loud. It's a cool place. Now, cool people go there. When does it become officially active so people can enroll to be a participant?
At the present time, we are testing our enrollment process. In a few weeks, I would say by early September, anyone will be able to join the All of Us program. Connecting with us with QR code on our website, calling us, emailing us, or when they come to the clinic to see their doctor at our medical center, they can express interest in the All of Us research program. Our team will be there to either escort them to the All of Us research unit in the first floor DELP, or give them an appointment to come back and enroll in the All of Us program.
So we've got a QR code on the screen if you want to learn more. We'll take you to joinallofus.org/Heartland. Dr. Denny, how long of a commitment are they going to be there for the folks who sign up to be participants?
Well, this is what we call a longitudinal program. The idea is that people will be partners with us for a long time, decades. We want this program to have this a multi-decade history that we expect doctors in the future, when they come and see their patients, will maybe they'll see their patient, they'll have an all of us risk score. They will know how, gosh, this high blood pressure med is going to work better for you because of all of us. And the only way that's going to happen, and we learn those outcomes, is by people being partners with us. In fact, we're now looking, right now, the only requirement basically we have is you have to be over 18. And we're looking at breaking that to enroll children as well. That's part of the future of the program. We really want to think of families enrolling and in this really growing to be a program that people are proud to be part of. We continue to return information to you. You answer new surveys with us and are just partners with us in this program. This isn't the typical research subject kind of thing. We try to see this, and when we think of this as a partnership with our participants. I'm a participant. I should say that I have one of those genetic variants, a couple of them that change how medications work for me, ones that I've studied for decades actually, that I didn't know I had the variant for until I went through all of us. And so that will change my healthcare personally in the future. And that's what the kind of impact I want to see for all of our participants that join us.
It makes such a big difference. I have variants within my family that's dramatically shifted some of the healthcare for several of my family members, and myself included too. So, knowledge is a powerful thing, and it allows us to do things together we may not have thought we could do. Dr. Denny, if someone does sign up, what's expected of them?
Well, Dr. Ojo covered some of these steps initially, and you covered some of these online, and the sites will tell you more, and I encourage everyone to look there. But essentially, you'll come in, you'll go through a consent process. We have a video that you get to watch and talk about what the program is like. Then you agree to participate, you agree to share electronic health records, and at that point, then you're offered to collect biospecimens. Most of the people will come in and actually get a biospecimen collection in one of these hospitals that Dr. Ojo went through that is partnered with the program. But we also allow, if someone's in a rural area that isn't close to a recruitment spot, we can send you a saliva kit to send a spit sample back, and we can get DNA results from those as well. And then over time, you'll get to answer new surveys. You have some initial surveys you answer, and then we ask new surveys, probably about one a year. It's not a huge commitment of time. And then we send you information. We send latest studies, what we're finding. You can search all that. You can see all the thousands of research projects that this program is already enabling. Diabetes, heart failure, cancers, smoking, other exposures, environmental exposures, air pollution, all those things are being addressed now, and more to come with the participation of your population that I'm so excited to have joining this program.
Yeah, I think it's cool that the Heartland's included, because we have a lot of rural folks up here. It's a lot of farmland, a lot of the Ozarks are here, the Flint Hills, and so much, and then some urban areas that are actually, again, Wyandotte County is incredibly diverse. Okay, well, let's visit with Stuart, our Stu in the control room. Stu, are you Han Solo or are you Spock?
Spock. Sorry to say.
Awesome. Well done, man. Okay, now, Stuart, how did you hear about all of us?
I feel a little ahead of the curve in the sense that I didn't hear about it from the health system or KU Medical Center. Part of my job is to stay on top of health-related news, and I think I just read an article talking about the national program, because it's been going on for a few years, just not here in the Midwest. And it was talking about this ambitious effort to create this giant pool of participants, and anyone can sign up, I read, so I said, why not?
So tell me why you in particular wanted to sign up, and have you convinced others to sign up also?
I haven't convinced anyone else yet, but that's more or less the purpose of this program today. But I want to contribute something, where I think some people talk about, eventually I want to pass away and donate my body to science or donate my body to research. And, you don't have to wait to pass away to get involved in medical research. You can get involved now. And so this is one super duper easy way to do it.
And so this is not your first involvement in healthcare or in health research.
Yes, I think that helped me kind of know what I was getting myself into. Basically, working here at the health system, I occasionally will see a flyer saying, hey, we're recruiting for so-and-so study. So this will be my third time being involved in a study where more or less you just go through a consent process. You usually fill out some kind of survey or health history and then give a blood sample. And so I'm looking forward to giving my samples for all of us.
All right, so what's it been like so far?
Well, because I signed up early and I haven't been able to give my specimens here in the Midwest, it's really just been using an app. I have to compliment whoever made that app. The All of Us app on the phone is like super easy to use. You have to create an account, which basically means sign up with an email or your phone number, create a password, make sure that works. Like Dr. Denny said, there's a video you watch to make sure you understand what you're getting yourself into. There is a consent process, which is super important in research, of course, where you have to consent to everything that's going to happen. There's nothing that's happening without your consent. And then after that, it's basically filling out kind of health questionnaires that you might fill out when you're kind of in a doctor's office for the first time about your health history. I gave it access to my health records if it needs it. And basically now I'm waiting on my next step to go donate my samples.
Well, thank you, Spock, and thanks for being a part of this. We're going to get scheduled for a sample soon, bringing new meaning to the words live long and prosper. All right, docs, team, this isn't a study in the traditional sense of the word, but the data collected will help in many future studies. Talk with us about how and when that's going to happen.
Well, it's happening now. It's already happening.
Well, you mentioned yourself. I mean, that's a good example.
So, I'm part of this. You talked about cystic fibrosis, and I have that condition in my family as well. My grandparents had 4 children that died at less than the age of 1 from cystic fibrosis, and that's part of the reason why I'm here today. In that narrative, and the first physician in our family. And then I have a son who has another rare condition. And it took us 7 years to figure out the condition he had. his genetic variant is not in a lot of these common databases we go to, but his genetic variant is in all of us. And so we see the research that's happening is already, I can already see the personal benefit to me, and the future people that have that genetic variant, we can start to, we are building, it's not even starting, we are building that database and that information that says this genetic variant makes a difference. And so maybe that next person won't wait 7 years to figure out what's going on. We can shorten that gap and make real health impacts for real people.
And we've seen what happens when we shorten the gap from concept to development. I am going to say it out loud, messenger RNA vaccines for COVID saved thousands and thousands and thousands of lives. We shorten the gaps, and we can do that for all sorts of drugs, on all sorts of diseases and all sorts of defects. What a difference that's made. That is the golden era of medicine. So a lot of people have been worried about their information being kept private. How are we going to make sure privacy is maintained?
I'm so glad you asked this question, because it is the #1 question we hear, is how do we protect a patient's privacy? Because in our program, we want to stay in contact with you. So that means that we do know who you are through the app, and as Stu talked about, or Spock talked about, and we do have that ongoing relationship. But that's just through the app. The researchers see information without any of those identifiers. All that stuff is name, address, and we ask for your social security number, which is optional. You don't have to give it to us, but we just use that to link information to bring in. We don't expose any of that stuff, and it's all protected in our sequestered enclaves, and we do all sorts of the best kind of security protections we can. We have 30-party assessors. We have constant penetration testing. We have employed these white hat hackers to try to break in and help us find faults with bug bounties and things like that to help us find and make sure our system's secure.
This is language I bet you didn't always know. Bug bounties, that's pretty good.
Thank you, yeah. I've learned a lot in this program, and we really try to employ a lot of great folks to, people are really eager to participate because everyone sees the need and the opportunity. So we get great people to help secure the information, to make the information usable, to build ways that researchers of all types can come on and use the system, including high school students, in this protected way, can come do research that once was sequestered to just the most powerful healthcare systems.
That is such a great, and I think it reassures me, and it should reassure everyone, how much attention is being spent to this. So you're safe when you help make all of us safe. Okay, we're here to answer your questions. Send them using the links on your screen, YouTube, Facebook, or email the Medical News Network. Let's check in with Doc Hawk, aka Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. The summer COVID wave is still going strong. We have some late breaking news about it growing strong right here at KU, Hawkeye.
Yeah, it is so unfortunate that it is continuing to increase. I was hoping by this time, by when school is going to be starting, that we would start to see some decreases in some of the measures that we look at, such as wastewater testing, as well as hospitalizations and test positivity as well. The best data we have, again, there are caveats to it because not everybody is reporting the data. It is from 10 days ago or so, but even at the CDC, it did show that from the previous week, there was an increase in all of those things I mentioned: hospitalizations, test positivity, and people who are going to the emergency department to be evaluated. It was a small increase, but unfortunately it was an increase. We haven't seen that plateau, especially in the wastewater testing that you have kind of talked about in the past as well. So unfortunate, we know school is starting, but we know hospitalizations are increasing. So that means basically that the virus is still out there circulating at a pretty good pace.
Yeah, we've looked at the CDC wastewater graph. Most states reporting either high or very high, and you can see it. It's gone up pretty dramatically. Wastewater activity in the west and south are higher than even last summer, even as high as this past winter. And just to say out loud, on July 24th, we had 7 patients hospitalized with COVID, and today we have 21. So we've tripled our numbers. Again, still relatively low, nothing like the 250 we had at one point, but enough to say we just need to be a little more careful, a little more thoughtful, especially when you're out in crowded public spaces, and if you have a history of more severe chronic disease, or you are living with someone or you're close to someone who may be older in a high-risk category. Hawk, any other thoughts you have?
No, I think you're right exactly on that point. You know, for most Americans, really the pandemic is quote unquote over. But we can't be myopic in our vision, and we have to understand that there are populations and there are people, loved ones, friends, family, who are at risk of severe disease. And so it is continually to be important to do those pillars and follow those pillars of public health, like you have so often talked about. Number one, know the situation that you're going to be going into. Is it outdoors? Is it in enclosed spaces? How many people are going to be there? Number two, it is always okay to wear a mask and acceptable to wear a mask. That will help reduce your chance of getting infected. The other thing is obviously frequent hand hygiene. Hand hygiene with either soap and water or alcohol-based hand sanitizers, and try to avoid putting your hands in your eyes, your nose, your mouth. We do it many times a minute without even knowing and understanding that we do it. It is so subconscious. And then the last thing, if you are sick or if your child is sick, do not go to work or do not send your child to school. I know that in the real world that is very difficult because we do have bills to pay, and we can't just leave children at home without childcare. There are very high barriers to that sometimes, but it is important to try and remember to try and protect other people around you as well if you are sick. And especially if you are high risk and you do have symptoms, test early. You may have to test 1 or 2 or even 3 days in a row if you're using the at-home tests, but test early and have a plan, talk with your physician, and try to get on those oral antiviral drugs to help reduce your chance of going to the emergency department, going to the hospital, and of course going to the ICU.
You know, Hawkeye, thank you. And I think we can safely say the rules of infection prevention control continue to keep you safe wherever you go up until this day and in this moment and every day going forward. So thank you. All right, we know many of you have questions. Let's head to Studio B with Alexis. Alexis, what's up out there?
Good morning. I have a great question from Rob Diebert. Rob writes, do I have to live in the KCK metro area to participate in All of Us?
No, you can live anywhere and be a participant in the All of Us program. If you are not close enough to donate your specimen at anywhere in the KCK area, we can arrange for you to go to any of the other sites across the country and in other states in the heartland to donate your specimen. And there's the option that Dr. Denny mentioned, which we can send a kit to you, and you can take that, provide saliva, and that can be a source of DNA. And everything else you can do electronically.
That's pretty darn good. And aren't we going to open up some sites in Kansas and some different areas too? So it's coming to lots of different communities.
It's coming to a lot of different communities in the KCK area and across the state. We are working closely with the extension stations throughout the states, and we have healthcare facilities part of the KU, University of Kansas Health System, that will also be enrolling participants.
Awesome. And I know Mizzou has places all over with the University of Missouri Healthcare. I know Iowa clearly does. I know Nebraska's all over the state. So there will be lots of places for people to become part of the Heartland Consortium.
Indeed.
Alexis.
That's a great answer because we have so many viewers from all over the country that watch this program, so they will like that answer. Amy has a question.
All of us is everywhere. How's that? That's that's pretty good. All of us are everywhere. Yeah,
all of us.
All right. Watch out.
Amy
Spock.
wants to know, if I change my mind, can I ask to pull out of the program?
Definitely. You can always, as you come into the program, after you first create that registration on the website or the app, after that, that's actually just the first step, and then you go through the consent. After the consent and you're part of the program, you can withdraw at any point as well. You can withdraw through the app, you can withdraw by calling the phone line that we have available, you can find on the website, you can find from the app, you can find everywhere. We make it easy to see what your level of participation is and decide what you want to do.
Marcia has a question. Marcia would like to know how long till we see the results of All of Us.
You know, we have a lot of people that have signed up. We have 820,000 some odd participants that have signed up.
Wow.
We started genetic testing after working with the FDA and a bunch of other partners at the, when was it? At end of 22 now? I'm trying to think. A little over a year now. And so it takes a long time to get through the backlog. We are actually doing genetic results return faster than any other program I know in history, but we still have a gap. So At this point, it would probably, if you signed up today, you're probably looking at sometime earliest in 2025 when that result would be available after you gave blood or DNA. So it would be a little while, but it will come if you want it. We don't require you to get that information back. Some people don't want that information. That's fine. But if you want it, we'll be offering it.
I have a question that just came in about the cost. Jill wants to know, do I need insurance to participate? Who covers the labs that you're talking about?
You do not need insurance to participate. This is a research program. It is free. If you come into an on-site location to donate biospecimens, you get a $25, I don't know if you do a gift card or how you do that, yes. But a small, compensation for your time. But really, there's no requirement. The lab, the results we return, we pay for. It's our return of value to you. It's ways we think we can help make your healthcare better, and it's part of the research project. We want to return results. We want to be a feedback loop that your participation, our ability to discover, allows us to make those results better too. We are actually one of the top 20 clinical testing labs now in the world amongst all these private companies and all these other people that have been in business for decades. We're one of the largest now. And that's how we make healthcare better. It's giving that information back.
I have a follow-up question from Marcia. Marcia asks, this is a specific question about the research. Will this research help inform cancer research?
Ooh. Yes. There are probably hundreds of cancer studies going on now. I haven't actually looked recently, but we have over 10,000 research projects that have been started in this de-identified, research database that we're talking about. I know there are ones going on in cancer. I actually have a research lab in addition to running the All of Us program, and I know some folks in my lab are looking at cancers as well, and we're looking at all sorts of kinds of cancer. Right now in our lab, I can tell you we're looking at breast, ovarian, some other multi-cancer syndromes in that, and how we can interpret genetic variants and predict who's at risk for cancer. I know someone else that's looking at cancer disparities and screening disparities and how that look and the effect of air pollution on cancer risk. So there are all sorts of cancer studies that are going, and that's just one example. We could talk about heart failure, rheumatoid arthritis, lupus, so many conditions that this is helping accelerate research.
And this has been an amazing discussion. I want to thank all of us for being, for all of you, for being participants in this. And I want to ask for some final thoughts before we go. Stu, our son of Spock, tell us your final thought.
I want to change my answer from earlier. Less Spock, more Captain Picard, I hope.
Oh, that fits kind of the whole head thing. I gotcha. Okay. We can cover that, so to speak.
But two more things. One, signing up for All of Us is super easy. There's an app. It kind of walks you through it. So if you can use a phone, if you're pretty good with just using a computer, super easy. And then two is that I'm happy to participate, but I also know that as a white man, I'm already very well represented in medical research. So I encourage anyone who is not a white man to also think about participating, so that they can, help improve representation in medical research.
Yeah, thank you. You're like perfect for this role. That's great. You should come back on the program more often, man. Dr. Ojo.
Yeah, so precision medicine is what all of us is about, and precision medicine requires precise information on all individuals. So anyone can participate in the All of Us research program, especially individuals who have been traditionally underrepresented in research. This is important.
Dr. Salate.
I think the future is now, right? This is getting us to a completely different way of providing medicine and prevention to people that desperately need it. We need everybody who wants to participate to really participate for the long term, right? The long term is the piece in this. We can only evaluate these kinds of risks and these alleles if we know what the long-term outcome is going to be. Billions of changes, right? They need a long time follow-up. So this is the future. This will be the future for everybody. So all of us, let's participate in this.
So true. Thank you. Dr. Denny.
You all said it so well. I think it takes all of us to help each of us. and we need to be in a community to do that. We need, $1 million's not a cap. I'm feeling so good about this conversation. I'm so excited about the Heartland being part of this in a much bigger way than we have, and I'm really looking forward to everyone listening and all of you who feel the call to do this, to join and be on this journey with us and make healthcare better for all of us, and yourselves, your communities, all sorts of kinds of diversity. It's not just race and ethnicity. Here we're talking a lot about rural, but it's also, we think about education, we think about those, I talked about geographies and environmental exposures. It's disabilities. We have veterans participating, and all those kinds of things that we think about, the rich diversity. We ask those questions. We want to know, and we want to participate, and we want to help make everyone better. So thank you so much for this opportunity to be on this program.
Thank you guys for being on this program. You know, we have talked so much here about faith, hope, and science, and the intersection of those three things. And I think about when I was a young resident, the physician who was the head of our program, he used to sit and tell us, this is a great time to be in medicine. And we know we were young interns, we were struggling to get by. I was in the middle of the HIV crisis. A third of our HIV patients, or a third of our admissions were HIV, 85% of them died on that admission. I mean, I think that was one of the worst times to be in healthcare. And he would look at us and he would say, this is a great time to be in medicine. I think of all that we've been through in the last few years. And I still say, this is a great time to be in medicine. It is a true golden age. I'm gonna tell a story. I was sitting in my cystic fibrosis clinic and had a patient that we followed. And you remember, cystic fibrosis is a disease dominated by coughing and mucus. And so many of those patients will not go out in public. They won't go to restaurants. They don't go to shows. Because they're embarrassed. They cough so much and it causes so much disruption. And if they start to laugh with a group of people, they usually start to cough. So coughing is the hallmark of cystic fibrosis, and it curtails the lives of so many patients and shortens the lives for so many years. The patient started this new medication called Kalydeco. She had a specific defect, G551D, and the drug was precisely meant for people with G551D. She took it for a few days. She had a lot of mucus, coughed up a ton of mucus. And every morning she would do her therapy vest, would shake her, and her chest would rattle around, try and get more mucus out. And her husband would go downstairs and make coffee. And on this particular morning, just a couple of days after starting the drug Kalydeco, her husband was making her coffee, and he grew concerned because he didn't hear his wife coughing while she was doing the vest. So he went to the bottom of the stairs and looked up, and because he was worried, was she okay, what was going on? And he saw his wife at the top of the stairs, and he said, I was worried about you because I couldn't hear you cough. And she said, I don't have to cough. I don't have to cough. In that moment, it crystallized for me the meaning of precision medicine, a specific drug for a defect that didn't just change a life, it changed a lifetime. If our discussion has piqued your interest and you'd like to sign up, use a QR code on the screen. It takes you to the website to learn more. Join allofus.org/Heartland. Your participation may impact, it will impact, the future of medicine, and perhaps even your life or the life of someone you love. It takes all of us so that none of us, have to cough. Thanks again to all of our guests, and remember, faith, hope, and science. We'll see you next week.
Coming up Friday on the Morning Medical Update, there's a culinary medicine movement underway. I'm Jessica Lovell on the next Morning Medical Update. When it comes to your health, food can be both a threat and the medicine. We see what's being taught to the next generation of doctors and meet a chef who had to give up red meat after a tick bite. Friday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.